Diabetes, popularly known as sugar disease, is something you're probably familiar with in humans and know that it's a widespread metabolic disorder that can quickly become life-threatening. But type 2 of this nasty disease is also common in cats. Diabetes can be treated, however, provided it is detected in time. In the following video, we'll explain 8 signs that your cat may have diabetes. Number 1. Fatigue and tiredness. Cats with diabetes can't metabolize sugar properly, meaning their bodies don't process sugar properly. Sugar chemically includes all carbohydrates, and carbohydrates are important for energy balance. Thus, a diabetic cat cannot get enough energy from food. As a result, they are weak and listless. They are often tired, withdraw and sleep long and often. During activities, they are quickly exhausted and appear lethargic. Number 2. Increased food intake. Due to not being able to properly absorb energy from food, a cat with diabetes has an urge to eat more food. This is not due to increased appetite, but because their instinct tells them that they need more energy to survive. Since diabetes is often triggered by obesity and cats with diabetes are thus often obese, their owners frequently think nothing of it when their house pets eat a lot. After all, they have been doing this for a long time, otherwise they would not be overweight. Diabetes, however, tends to increase the urge to eat even more. If you overlook this, it can have fatal consequences for your cat. Number 3. Weight loss. Despite the increased food intake, however, cats with diabetes lose weight. This trend is often perceived as a positive thing by owners of overweight cats, but it's actually a serious sign of disease. If your cat eats a lot and loses weight, there is definitely something wrong with them. The fact that they are losing weight despite eating a lot of food is again due to the fact that their metabolism is not utilizing the energy from the food properly. Much of the energy is not absorbed at all, and what is utilized is consumed directly for bodily functions. In addition, diabetes leads to the inability to store fat reserves, which further accelerates weight loss. Number 4. Increased urine output. A major characteristic of diabetes is that the blood sugar level is elevated because the sugar from food cannot be utilized normally in the metabolism. The excess sugar from the blood is excreted through the urine. In the process, the urine is greatly diluted, which causes it to make its way into the bladder more quickly. Cats with diabetes therefore urinate more frequently and pass large amounts of urine. Number 5. Increased fluid intake. The increased excretion of urine results in a stronger feeling of thirst. The cat has the urge to compensate for the excreted fluid by drinking more. Cats with diabetes therefore drink more frequently and in larger quantities than healthy cats. However, they often do not even manage to take in as much fluid as they lose. Number 6. Dull, scaly hair coat. Hair and skin are a reflection of how they feel inside, as they are only fine when their metabolism is working properly. Cats with diabetes often look shaggy, their coat is lackluster and appears unkempt. Dandruff forms on the skin and then hangs in the hair, which emphasizes the sickly appearance. Number 7. Plantigrade gait. Since diabetes also damages the nerve functions, some sick cats show a so-called plantigrade gait. Here they do not put only the paws on the ground as usual, but put the whole lower part of the hind legs on the ground when walking. This causes them to walk with their abdomen lowered, so that their mobility is impaired. Number 8. Lame hind legs. Plantigrade gait does not always occur, but often the hind legs of the cat with diabetes are so weakened by nerve damage that they become lame and immobile. In particular, cats with diabetes often cannot jump or can only jump clumsily and awkwardly, but even normal walking can be severely affected. If you notice one or more of the above symptoms, you should quickly take your cat to the vet. Suspicion of diabetes is not to be trifled with, because if the disease is left untreated, it can soon lead to death. You should be on high alert if your pet refuses to eat or drink, then the energy metabolism is completely out of whack and there is an acute risk of death. By the way, an extremely important factor that influences whether a cat gets diabetes or stays healthy is the right cat food. If you want to learn more about this, click on the picture on the left. Or are you interested in the 15 signs with which your cat's body begs for help? Then click on the right.